base of the stable, the calcaneus, which is the bone at the back, and then it curves out and uses the arch appropriately. Okay, so if we just compare this.
Now, for a woman who likes shoes, orthotics always makes me think about something big and clunky. How has it become modernized for us women? And
well,
our men.
yeah, they've gotten so much better with orthotics. Yeah. And that's the thing about orthotics can only be helpful if their compliance is by the patient wearing them.
Exactly.
So the orthotics are so much more thin. You can have a dress shoe orthotic that's very thin, not just thin in the material, but thin in the profile front to back. And that way you can fit in a narrow shoe, and you're still getting the support to keep the arch so that it's a more stable platform.
Excellent.
And if you're wearing the orthotic, then you're creating that kinetic chain from the bottom up to be much stronger. You know, the song, the knee bones connect to the ankle bone.
Exactly. That's one of my favorite sayings, actually. You know, because people try to compartmentalize health, and we have to bring it all together.
Oh, yes, definitely. Yeah. So if you're not stable with something on the right foot, and you're saying that you see some for that, then you're getting some correction. This is what we want to see on this right side. This is you on the left side.
Okay.
And you can see how that
pretty significant.
Dotted line. Yeah, it is quite a bit.
I told you you'd have fun with my feet.
Yeah, this is not where you're going to score. This might be affecting your golf game too.
Well, in actual fact, I'd like you to tell me, having this kind of profile, what other injuries might I be prone to?
Okay, so with the foot going through and the ankle changing, if we just take a shoe and someone's landing and they're rolling in a little bit because the arch is collapsing, that actually causes the bone that's attached to the foot, the tibia, to rotate in. And with that rotation that's going to cause pressure on the medial side of the knee, the inner knee. Okay?
Yes.
So with that constant strain on the ligaments and tendons of that side, you can get tendonitis, you can get cartilage problems, you get degeneration.
Genius. That's exactly what I'm being treated for.
And then that can lead up to the hip as well, because you get some tightness in the groin on one side, the buttock muscles change because they're turned around a little bit more. So you get weakness, and then that can go all the way to the back. So then we see people with back problems, their foot problems. So
exactly. So this cascades into the whole concept of running, because for example, for myself, having this kind of profile, I've had to stop running because it's cascaded into my knee.
Yes. Yep.
So let's talk about some of the other aspects of some of the latest gear in running and foot health. What else are we seeing out there?
Well, the new, I shouldn't say relatively new, is barefoot running or minimalist shoes, which is what this the shoe is here, the Merrell Trail Glove. I use this. I don't do so much barefoot running on the road. I'll use it a little bit on the road, but trail running when it's dirt or grass or anything, I love this shoe. It's basically you're looking at a zero lift heel to forefoot, as opposed to most running shoes. And when they started developing running shoes in about 1972 with an actual heel lift, they were basically going for cushioning and stability. But before that, shoes were just worn as protection for the foot.
Sure.
You just wore them.
I'm thinking about all my running shoes and how they basically have tire tracks on the bottom. How is it different for the foot relative to barefoot running?
Well, for this type of shoe, you're trying to get the barefoot running, still giving protection in the bottom of the foot. Your stride has to change when you're using a minimal shoe or a zero heel lift shoe, that you're going to be landing more midfoot or forefoot. You don't have that big cushion in landing the heel. Now, what it's compared to is, say if someone was jumping off of a chair into sand, you basically have to loosen up your ankles and your knees to absorb that. You have to tighten up your ankles and your knees to absorb that, and you feel a little unstable. Well, that's the same as a running shoe. If it's got a lot of cushion and you're landing something really soft, then you stiffen up the knee, you stiff up the ankle, and you're actually trying to make yourself stable.
Okay.
If you have something very little cushion and you're landing and you feel harder, you make your ankle and knee absorb it better, and that's actually causing more exercising going on.
So it might not necessarily be a fad then. There is
there's definitely science behind it. There's
yeah.
questioning the science of why there is such cushion in running shoes. I'm at the point where I think that you still have to be careful with certain people.
Sure.
If they actually need an orthotic and they have poor overpronation of the foot, you know, going to this type of shoe, they're going to have problems and develop knee problems. You really have to build up strength in the foot. So there's actually exercises you can do for the foot to help your arch.
Okay, which we'll cover in another segment. But in terms of golf, that's another sport that we're getting into. So what are the special care needs that we need to be thinking about when we're talking about golf?
There is a specific golf orthotics, which I recommend, because if I recommend that people walk when they're golfing as opposed to in a cart.
Yeah,
so if you're
carts.
No carts, environmentally friendly as well. So if you're going to be on your feet all the time, then having the proper orthotic is going to help you not tire in your knee, your back, keeping yourself.
And it is different than a regular orthotic?
Yeah, it's a bit different. The materials they use on the top to keep your grip better when you're standing and you're doing rotation. A lot of torque that's developed in the golf swing. So you want to have a good firm base in that golf shoe.
Okay, so. Excellent. Thank you so much for the analysis.
Oh, you're welcome.
We appreciate knowing more about the special considerations for sports and feet science. So coming up next after the break, what can the way you walk tell us about your health? I've had orthotics.
Once I went for makeup,
When it comes to feet, Americans seem to think pain is normal. 8 out of 10 people responding to a 2009 survey from the American Podiatric Medical Association reported having at least one foot ailment in the past year. More than half complained of heel pain. Others were crying ouch because of blisters, corns, pinched nerves, and ingrown toenails. Welcome back to Revivelife Wellness Show and our show on foot health. Foot pain is not normal, and yet people put up with it. About 35% of those who reported heel pain in the survey, for instance, said they had it for 2 years or longer. We're back on our final segment with our guest, Andrea Beausoleil, who's a kinesiologist. Welcome and thanks for joining us today. Been speaking a lot about feet.
Yeah.
Now, your profession, you're a kinesiologist, but you're also a
podorthist.
Podorthist,
Yeah.
thank you. I want to say podiatrist, but you're a podorthist.
Yeah.
Can you help us understand the difference?
Sure. So at podorthist, we really specialize in orthotics and footwear.
Okay.
So basically we're trained in the anatomy and the biomechanics of the lower limb and the foot. So a lot of times we work alongside different chiropractors or physiotherapists, medical doctors, and we sort of take care of the foot health and mobility.
Okay, so would you actually be the person doing the diagnosing, or would the other professional do the diagnosing? And then
Usually the patient comes with
Okay.
a prescription and a diagnosis from
Okay.
their medical doctor.
Okay.
And then we fill that and we take upon our own assessment and we take a health history. We take a look at the patient walking, and we then prescribe what type of orthotic or off the shelf or shoe modification even that the patient might need.
So what is the difference between a podorthist and a podiatrist?
Well, a podiatrist is a medical doctor.
Okay.
And so they can be doing anything from performing surgeries and prescribing medication. So we're really on the side of the biomechanics, and we also deal with a lot of injury, chronic injury sometimes, but also acute injury. So like some of the chiropractors that spoke before, plantar fascia, metatarsalgia, neuromas, Achilles tendonitis, common injuries like that.
Did I miss any when we were speaking earlier that you would commonly see?
I think you guys touched on the plantar fascia. I don't know if you touched on the metatarsalgia.
We didn't.
Sometimes that gets confused with neuromas. So basically metatarsalgia is an inflammation of the soft tissue around the metatarsal head.
Okay. Which are the toes.
Exactly.
Yeah.
Neuroma is when that nerve in between the toes is actually pinched by the inflammation of both those heads. So sometimes there's a difference in the symptoms. A neuroma is much more severe. Oftentimes, if it can be beyond help with an orthotic, there are surgeries that are required.
Yeah, as a matter of fact, I had a call from my girlfriend, and her daughter's a dancer, and she's being told that she can't dance anymore because she has a severe neuroma. So that would that be pretty typical?
Yeah, that happens a lot, and again, it's really the foot type. So some of us are blessed with good mechanics, and we have good feet, right? Some of us don't have those genetics.
Yeah, if anybody saw my feet when we were doing the gait analysis, I have several issues.
Right.
But yeah.
So, and that goes along with, you know, a lot of people are concerned, well, are these shoes bad or are these shoes good? It really depends on the foot type. Some people have a high arch, some people have a low arch. Not one of them is good or bad. It all depends on the mechanics of the rest of your body.
Okay.
Some people have really flat feet. They never are injured.
So I'm curious, what kind of shoes are you wearing?
So I'm wearing a little bit of a heel.
Okay.
But again, I am better in a heel than a flat shoe.
Okay, because of the mechanics
Yeah,
of your foot.
because of my foot type. So that's what people have to understand, and a lot of times we wear what we maybe shouldn't wear.
Sure.
Not everybody can wear flip-flops. Some people can live in them. So you have to get to know your body and know what's right for you. And again, pain is a really good indicator.
Yes,
Right?
exactly.
If you have a lot of pain and you're wearing a flat shoe or you're wearing 4-inch heels, you know, should use some common sense, and then you'll know what
And
is
what
best.
kind of foot type do you have that would be okay to wear a heel?
Again, it depends, because when it comes to your foot and the ankle joint, and I know Dr. Melissa Barrett was talking about pronation and supination.
Yes.
A lot has to do with how much movement there is in the foot. So you could have a high arch and have a really rigid foot type. So you have a high arch and there's not much movement. You could have a high arch and a lot of movement. So again, it's sort of a spectrum.
Okay.
So
it's not that easy, and again, people
Yep.
should consult a professional.
exactly,
Yeah.
because there
Okay.
are a lot of things that come into play.
I was excited to hear that there are shoes that actually have orthotics made in them,
Yeah.
so that they can actually be pleasant to look at, but yet they've got the mechanics
Yeah.
taken care of too.
Usually they call those orthopedic footwear.
Okay.
And sometimes there's a little bit of a built-up arch. Sometimes there's a little bit of a metatarsal pad underneath the toes. Again, it's not custom to somebody's foot, but it does work for some people. And again, if it depends how extreme the injury or the conditions or the abnormalities of the foot, but they do work.
So with Dr. Swayze, we did the gait analysis. So we understand that for someone like myself or many other people out there, they might need an orthotic and some support. So how would you go about then taking it from there, taking the prescription and giving us a solution?
So basically we meet the patient and we always do a history on their health. If they've had any major injuries, if they have pain that's acute or chronic. Even things like back pain, that can determine a lot when it comes to your feet, because your feet are the foundation, right? So basically, we take a health history, we watch the patient, we look at them stand, we look at them from different angles, from the side, we look at posture, we take a look at the foot itself, high arch, medium arch, low arch, toes, things like that. Then we do so a non-weight bearing examination, and we look at range of motion, and then we also watch the patient walk. And sometimes we even watch the patient run, depending if their pain is when they run.
Sure.
We'll get them on a treadmill, and we'll take a look and see what happens. And that's the really tricky part, because there's a lot happening in those few seconds of a step. But that says a lot about a person's foot type and their conditions. We also look at shoes. So if you flip somebody's shoes over and you look at
That's
the
a good
sole,
one. Yeah.
it says a lot about what's going on.
They wear their edge away on the inside
Exactly.
or the outside or the heel.
Yep.
Now you brought something, a casting. So I know this word is used a lot, casting.
Yep.
What does that mean?
So basically, there's a few different ways of taking an imprint of somebody's foot or making an orthotic. A really popular one is that you take a foot impression, and basically you're just taking the foot in a or a semi-weight bearing position. So the patient is seated, and you're getting that subtalar joint, so their ankle and their leg, in a neutral position, and then you take the imprint, and basically we pour plaster of Paris into that imprint, and then you have a cast that comes from there, and all the materials are molded, heat molded to that cast. So you can have orthotics for high heel shoes, figure skates, running shoes, a lot of different types of shoes. It just depends on what that person needs.
And do you need multiple pairs of orthotics if you wear all of those types of footwear?
Not necessarily. A really important factor is when you're having your pain. If you sit at a desk all day, but you're a runner in the evenings, and most of your pain is when you run, then most probably you would get more of a sport orthotic,
Okay.
and you would wear that when you run.